Hi everyone, so today I wanted to talk about formulations. They are something that I use widely in my role as a CBT therapist, but also as a forensic psychologist. And today we're going to be talking about the 5P formulation. So it is a really simple formulation that can give you a really good longitudinal understanding of an individual. So what I mean by longitudinal is you're looking at their life as a whole. So I'll break down what will go in each 5P and hopefully it will give you the encouragement to try it out with your clients or even try it out on yourself so you can get a feel of how it works. So first of all, I always normally put this in the top left hand corner. So we have predisposing. So predisposing is the things that happened in someone's childhood, in their early adolescence, in their adolescence, just anything that happened in their life that has impacted on their difficulties now or has led to the problem. So it could be something thinking about individuals who have experienced abuse or individuals who had a difficult time at school, if they had any losses early on in life, if they had any difficulties with friends, with their health, anything that would predispose them to developing a problem later on in life. As I said, this is really good for CBT in general or within psychology. So that's predisposing, that's the first one. And then we have the problematic one will go in the middle, and then we next have is precipitating. So precipitating is slightly different to predisposing. So precipitating would be the things that happened maybe right before the problem happened or the problem occurred. So they can often be seen as triggers. So I always think trying to reword the precipitating and use the word triggers instead, because that kind of helps me to kind of distinguish with the P's. So yes, precipitating, this could be an argument with someone, it could be losing a job, again it could be losing a loved one, and you may notice that there may be similarities between the predisposing and the precipitating, and that's fine. But it's just what triggered their problem occurring. So we have got, as I said, the problem goes in the middle normally. So what triggered? So if we use an example, it could be that an individual ended a relationship. It could be that they had an accident. Anything that triggered the problem. And then, as I said, we've got the predisposing. So what made this person vulnerable to the problem happening? So the problem is basically what is going on for that person? Why have they sought help now? What is it that they want support with? So again, this could be anxiety, it could be trauma, it could be PTSD, it could be OCD, it could be low self-esteem, low self-confidence. And as I said, with the forensic world, it could be their offending. So anything that is causing them a problem, and you may have a few different ones here, and again, that's fine. And you'll notice that there will begin to be a pattern. So normally, those two will feed into the problem. And then we have the fourth P, which is perpetuating. So with this, it is what is keeping that problem going. So what is keeping, you can see the cycle there. So what is keeping that cycle going around? Is it because if the trigger was that they've lost their job, that they've been unable to get a job? So is that kind of keeping that problem going for them? Could it be the people they're around? Could it be that they don't actually have the skills to manage what's going on for them? So just anything that is keeping that problem going for them. So again, if you're getting confused with the P's, just think about what is keeping this problem going for this person, what is maintaining their problem. And then we have the final fifth P, positive. So what are all this person's strengths? What are the good things that they've got going? What are the things that they enjoy? What are the things that are going to help you to manage the problem? So for example, if the problem was anxiety, and the perpetuating sorts maintaining it is avoiding certain situations. But their positive, their strengths, is that they they've got maybe a good close support network. So could you use some of their support network to help them when they're avoiding certain situations? Now, be careful with that, because you don't want then that person to rely on other individuals to go and do certain things. However, having a good support network is normally a really good strength, and you can utilise other people within therapy. So that is the positive. So that is all your 5 Ps. So I'll go over them quickly. So you've got predisposing. So what happened long term for this individual? What predisposed them to the problem occurring? Then you have the precipitating. So what are the triggers? What happened to that individual just before the problem really kind of became prominent for them, that became problematic for them? Then the problem. So what is their problem? What are they finding difficult? Precipitating. So what is keeping that problem going? What is maintaining that problem? And then positive. What are the good things that are going on for this individual? What sometimes I do is I will start with the problem, and then I'll work my way around. It's completely up to you. Again, I love scribbling it down. Sometimes I'll use a whiteboard that is sometimes behind me, or just kind of scribbling it down, but always getting the client to use it with you and to help you to guide therapy. I would often do this following doing the assessment. And then once I have done the formulation, that will then help the client to understand themselves, and for me to obviously understand how I can help them. And as I've mentioned, do it with the client, so it should be collaborative. That's really important, to get the client to understand themselves from a different perspective, but also really to help them to buy into the support, and really can see how whatever therapeutic model you're using, how that will be of benefit for them. And always kind of keeping it out on the desk or wherever as you go through the sessions, because that's really going to help you to, you can refer back to it, you can add to it. Just because you've done it once doesn't mean that that's it, completely done. You can continue to add to it as you go through therapy. It's a really good way, and as well to refer back to. So hope you found that helpful. If you would like more of these style of videos, then please let me know. And yeah, hope you're having a good day.